Health workers in spacesuit-like gear in Spain's capital Madrid, where a priest was brought in from Liberia infected by the deadly Ebola virus. The World Health Organization has declared an international health emergency to deal with the epidemic, which has killed over 900 people so far in 4 West African countries.
I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern. The committee's decision was unanimous. Its advice to me acknowledges the serious and unusual nature of the outbreak and the potential for further international spread, but also the need for strong international coordination of the response.
The current outbreak began from Guinea in March, but since then it has spread to neighboring countries Sierra Leone and Liberia. One confirmed death has even occurred in Nigeria. The Nigerian hospital where a US citizen died after flying in from Liberia remains shut down. A handful of other cases have also come up in Africa's most populous country. In Liberia, a state of national emergency has been declared to deal with the crisis. The army has been brought onto the streets to stop people from going into worst affected towns. Several countries have stopped flying into the affected nations. The United States has activated its Emergency Operations Center at the highest level of response to deal with the Ebola outbreak.
The U.S. is working in a coordinated way to support partner governments and the World Health Organization. I have activated the CDC Emergency Operations Center at level 1 for this outbreak. This is our highest level of response. It doesn't mean that there's an increased risk to Americans, but it does mean that we are taking an extensive effort to do everything we can to stop the outbreaks.
At home in India, reports have emerged of the Ebola scare reaching Delhi, with suspected patients being kept under watch. Union Health Minister Dr. Harshvardhan has informed in Parliament that India is alert to the danger of the virus being imported, with as many as 45,000 Indians living in the affected countries. Authorities in airlines and airports have been told to be on the lookout for suspected patients. Hospitals have been put on standby.
The idea is that you have to make sure that you are taking all possible precautions well in advance. That's what we are trying to do.
Routine checkup.
And yes, you see, if somebody is coming from that country and that country is having huge number of cases, as on today, this moment, there is no case of Ebola reported in India. You don't have to worry.
Ebola is a viral disease that causes hemorrhagic fever, affecting multiple organ systems. It has a high fatality rate of as much as 90%, but the level has been lower during the current outbreak. Early symptoms include fever, weakness, muscle pain, headaches and sore throat. Advanced stage symptoms include vomiting, diarrhea, impaired kidney and liver function, and sometimes internal and external bleeding. It spreads through contact with organs and bodily fluids like blood, saliva, urine, sweat of infected persons or animals. It is not airborne but has no known vaccine or cure. Treatment involves supporting organ functions and maintaining bodily fluids till the body fights off the infection. Prevention largely involves isolation of infected or suspected patients and extreme care in handling them by health workers or others. Experts are saying that the disease can be combated if the world pitches in to tackle it in the affected countries, but they also concede that the situation is likely to worsen at this stage before it improves. Newsnight Desk, DD News.